Good morning to all expectant parents. I'm Dr. Maxin, and I'm here to talk to you today about the significance of the last 2 months of pregnancy. The last 2 months of pregnancy are very important for the development and health of the baby and the mother. During this period, the baby grows rapidly, gains weight, and prepares for birth. The mother may experience physical and emotional changes, such as discomfort, fatigue, mood swings, and anxiety. Here are some of the main aspects of the significance of the last 2 months of pregnancy. There are 3 areas of concentration. 1 is the fetal development. In this last 2 months of pregnancy, the baby's organs and systems are maturing and preparing for life outside the womb. The baby's hair, nails, and skin are growing and changing. The baby's movements may become more frequent and noticeable. The baby's weight and length increase rapidly, and the baby may gain about half a pound per week in the last month. In this period, the babies cry or laugh in the womb as a way of practicing their communication skills and expressing their emotions. They do not make any sound, but they show their feelings through their facial expressions and body movements. Mothers can know when their babies cry or laugh in the womb by paying attention to their baby's movements and reactions to external stimuli, such as sounds, touch, and light. Also, mothers can also bond with their babies by talking, singing, or laughing to them, as babies can recognize their mother's voice and respond to it. Crying and laughing in the womb are signs of a healthy and developing baby. During the last 2 months, the baby's bones are soft, especially at the top of the skull, to ease delivery. The baby's position changes and it moves its head down into the pelvis, also called lightening, around last week. This helps the baby get ready for birth and may relieve some pressure on the mother's lungs and stomach. Now let's move on to maternal care. The mother's posture and body mechanics can affect the baby's position in the womb, the mother's comfort and health, and the labor and delivery process. Some helpful maternal positions during the last 2 months of pregnancy are: sitting with your hips higher than your knees, sitting with your back straight and your rib cage lifted off your middle, sitting on a firm exercise ball that allows your hips to be level with your knees or higher than your knees, lying on your side with a pillow between your legs, avoiding lying on your back for long periods, avoiding slouching, twisting, or bending at the waist, avoiding crossing your legs or ankles, avoiding lifting heavy objects or carrying weight on one side of your body. These positions can help the mother maintain good blood circulation, reduce back pain, prevent swelling, and encourage the baby to move into the optimal position for birth. The mother can also do some gentle exercises, such as walking, swimming, yoga, or pelvic tilts, to improve her flexibility, strength, and endurance. In addition to these positions and exercises, the mother should also eat a balanced and nutritious diet, drink plenty of fluids, and avoid alcohol, caffeine, and tobacco. Get enough rest and sleep, and avoid strenuous activities and heavy lifting. Continue to attend regular prenatal checkups and tests, and report any signs of complications or preterm labor to your doctor. Prepare your hospital bag, birth plan, and baby essentials ahead of time. Practice relaxation techniques, breathing exercises, and pelvic floor exercises to ease discomfort and prepare for labor. However, the mother should always consult with her healthcare provider before starting any physical activity during pregnancy. In the last 2 months of pregnancy, the mother may feel more uncomfortable, exhausted, and anxious. The mother should take care of herself by eating well, staying hydrated, resting, exercising moderately, and avoiding stress. The mother should also prepare for the baby's arrival by prepare your hospital bag, birth plan, and baby essentials, choosing a pediatrician, and learning about breastfeeding and newborn care ahead of time. The third area to concentrate is labor and delivery. The signs and stages of labor, and what to expect during the delivery process. Labor is triggered by a complex series of hormonal and physical changes that prepare the mother's body and the baby's body for delivery. Some of these changes include: the baby's lungs produce a substance called surfactant, which helps them breathe after birth. The baby's brain releases a hormone called corticotropin-releasing hormone, CRH, which stimulates the production of other hormones that initiate labor. The mother's uterus produces prostaglandins, which soften the cervix and increase contractions. The mother's pituitary gland releases oxytocin, which stimulates stronger and more frequent contractions. The mother's placenta produces estrogen, which enhances the effects of oxytocin and prostaglandins. These changes happen gradually and may not be noticeable to the mother or the baby. They are influenced by various factors, such as genetics, environment, nutrition, stress, and infection. Therefore, the exact timing and duration of labor vary from person to person and from pregnancy to pregnancy. One sign that labor may be approaching is when the baby drops or descends into the pelvis. This usually happens a few weeks before labor, but it can also happen during labor. When the baby drops, the mother may feel more pressure in her lower abdomen, more frequent urination, and easier breathing. However, dropping does not mean that the baby wants to come out or that labor will start soon. It is just a natural adjustment of the baby's position for birth. The signs of labor may include contractions, water breaking, bloody show, back pain, and diarrhea. The stages of labor are divided into 3 phases, which I won't like to talk about these in more detail. These stages are early labor, active labor, and transition. Early labor is the longest and least intense phase of labor. It usually lasts from 6 to 12 hours, but it can be shorter or longer. During this phase, the contractions are mild and irregular, and the cervix dilates from 0 to 3 centimeters. The mother may feel some discomfort, but she can still walk, talk, and do other activities. She may also have some light bleeding or mucus discharge, which is normal. The mother should try to relax, breathe deeply, and drink fluids during this phase. Active labor is the most intense and productive phase of labor. It usually lasts from 3 to 5 hours, but it can be shorter or longer. During this phase, the contractions are strong and regular, and the cervix dilates from 4 to 7 centimeters. The mother may feel more pain, pressure, and urge to push, but she should not push until the cervix is fully dilated. She may also have more bleeding or fluid leakage, which is normal. The mother should focus on her breathing, use coping techniques, and seek support from her team during this phase. Transition is the shortest and most difficult phase of labor. It usually lasts from 15 minutes to an hour, but it can be shorter or longer. During this phase, the contractions are very powerful and close together, and the cervix dilates from 8 to 10 centimeters. The mother may feel overwhelmed, exhausted, and restless, but she should remember that she is almost done. She may also have nausea, vomiting, shaking, or sweating, which is normal. The mother should concentrate on her breathing, listen to her body, and follow her instincts during this phase. The delivery process may involve pushing, episiotomy, vacuum extraction, forceps, or cesarean section, depending on the situation and the doctor's recommendation. The delivery process may also involve cutting the umbilical cord, delivering the placenta, and skin-to-skin contact with the baby. Pushing is the final stage of labor, when the mother uses her abdominal muscles and pelvic floor muscles to expel the baby out of the birth canal. It usually lasts from 30 minutes to 2 hours, but it can be shorter or longer. During this stage, the mother may feel a burning sensation, also called the ring of fire, as the baby's head crowns, or emerges from the vagina. The mother should push when she feels the urge, and rest between contractions. She should also follow the guidance of her doctor or midwife, who will help her deliver the baby safely and gently. Episiotomy is a surgical cut made in the perineum, the area between the vagina and the anus, to enlarge the vaginal opening and prevent tearing during delivery. It is not routinely done, but it may be necessary in some cases, such as when the baby is large, breech, or distressed, or when the mother has a prolonged or difficult labor. The doctor or midwife will use local anesthesia to numb the area before making the cut, and will stitch it up after the delivery. The mother may feel some pain, swelling, and bleeding after the episiotomy, and she should keep the area clean and dry to prevent infection and promote healing. Vacuum extraction is a procedure that uses a suction device, called a vacuum cup, to help pull the baby out of the birth canal. It is not routinely done, but it may be necessary in some cases, such as when the mother is too tired to push, or when the baby is in distress, or has an abnormal heart rate. The doctor or midwife will place the vacuum cup on the baby's head, and apply gentle traction during contractions, until the baby is delivered. The mother may feel some pressure and discomfort during the procedure, and the baby may have some bruising or swelling on the head, which will go away in a few days. Forceps are a pair of metal instruments that look like large spoons or tongs, that are used to help guide the baby out of the birth canal. They are not routinely done, but they may be necessary in some cases, such as when the baby is in an awkward position, or when the mother has a narrow pelvis, or a medical condition that prevents her from pushing. The doctor or midwife will insert the forceps into the vagina, and gently grasp the baby's head, and rotate or pull it during contractions, until the baby is delivered. The mother may feel some pain and pressure during the procedure, and the baby may have some marks or scratches on the face, which will heal in a few days. Caesarean section, also known as C-section, is a surgical operation that delivers the baby through an incision in the mother's abdomen and uterus. It is not routinely done, but it may be necessary in some cases, such as when the baby is too large, breech, or transverse, or when the mother has a placenta previa, a uterine rupture, or a severe infection. The doctor or midwife will use general or regional anesthesia to numb the mother before making the incision, and will lift the baby out of the uterus, and cut the umbilical cord. The mother may feel some tugging and pulling during the operation, and the baby may have some breathing difficulties, or low APGAR scores, which are measures of the baby's health at birth. The mother may also have some pain, bleeding, and infection after the operation, and she will need more time to recover and bond with the baby. The delivery process may also involve cutting the umbilical cord, delivering the placenta, and skin-to-skin contact with the baby. Cutting the umbilical cord is the process of separating the baby from the placenta, which is the organ that nourishes and supports the baby during pregnancy. The doctor or midwife will clamp and cut the cord after the baby is delivered, or after the cord stops pulsating, which may take a few minutes. The mother or the partner may also have the option to cut the cord, if they wish. The baby will have a stump of the cord attached to the navel, which will fall off in a few days. The mother may feel some cramping and bleeding as the placenta detaches from the uterus, and she should deliver the placenta within 30 minutes after the baby is born. The doctor or midwife will check the placenta for any abnormalities or missing pieces, and will massage the mother's abdomen to help the uterus contract and prevent excessive bleeding. Skin-to-skin contact is the process of placing the baby on the mother's chest or abdomen right after the delivery, or as soon as possible. This helps the baby regulate the body temperature, heart rate, and breathing, and also stimulates the production of breast milk and the release of oxytocin, which is the hormone that promotes bonding and reduces stress. The mother and the baby can also cuddle, kiss, and talk to each other, and the partner can also join in the skin-to-skin contact. The baby may also latch onto the mother's breast and start breastfeeding, which is beneficial for both the mother and the baby. These are some of the ways that the mother can prepare for a smooth labor and delivery experience. However, every pregnancy and birth is unique, and there may be unexpected situations or complications that require medical intervention or emergency care. The mother should always trust her instincts, listen to her body, and follow the advice of her health care provider, who will do their best to ensure a safe and healthy outcome for the mother and the baby. In conclusion, the last 2 months of pregnancy are very significant for the development and health of the baby and the mother. During this period, the baby grows rapidly, gains weight, and prepares for birth. The mother may experience physical and emotional changes, such as discomfort, fatigue, mood swings, and anxiety. The mother should take care of herself and the baby by eating well, staying hydrated, resting, exercising moderately, and avoiding stress. The mother should also prepare for the baby's arrival by preparing her hospital bag, birth plan, and baby essentials, choosing a pediatrician, and learning about breastfeeding and newborn care ahead of time. The mother should also be aware of the signs and stages of labor, and what to expect during the delivery process. The mother should also try to stay calm, focused, and supported during labor and delivery, and enjoy the skin-to-skin contact and bonding with the baby after the delivery. Thank you for your attention and participation. I hope this talk was informative and helpful for you. If you have any questions or feedback, please feel free to ask or share. I wish you all the best for your pregnancy and birth.
I rock the world with my AI. I'm the best there is, no one's better than me. I'm the king of